Hello friends, welcome back to Complete Medical Coding. Today I am here with a few more questions from the ICD section. Okay, let's discuss few more questions and few guidelines that needs to remember from the ICD code book. Okay, so if you are new to the channel, friends, please support me by subscribing to the channel. If you are liking my videos, please like and share. Please share it among your friends for those who are in need of, or for those, especially for those who are preparing for the examinations. These videos will be very useful, I hope. So let's move to the questions, more questions one by one. Moving to the first question. A 70-year-old patient is brought into the emergency department for a myocardial infarction. As you already know, there are two types of myocardial infarction. One is STMI and the other one is NSTMI. So these are the full form. STMI, NSTMI. NSTMI means non-ST elevation. So this is ST elevation myocardial infarction. STMI means ST elevation myocardial infarction. The emergency department physician administered thrombolytic therapy to treat the STMI, and within 2 hours the condition was converted to NSTMI. NSTMI means non-ST elevation MI. Okay, non-ST elevation myocardial infarction. So what ICD-10 CM code is reported? So here initially the patient was having the confirmed diagnosis as STMI, but then later the emergency department physician administered some thrombolytic therapy to treat the STMI, but within 2 hours the STMI was changed to non-STMI. Okay, non-ST elevated. So here what is the confirmed diagnosis? Here the final diagnosis. STMI is converted to NSTMI. So what will the doctor report the ICD code? Will the doctor report again STMI, or will the doctor report both STMI and NSTMI, or will the doctor report only NSTMI? Okay, that you have to find it out. So let's move to the codes diagnosis one by one. Okay, what is the first code? First option, I-21.9. What is I-21.9? Open ICD code book and go to I-21.9, which represents acute myocardial infarction. It doesn't mention any STMI or non-STMI. Okay, so this is just acute myocardial infarction. Let's see what is second one. I-21.4. I-21.4 is NSTMI myocardial infarction. Just NSTMI it is mentioned. Non-ST elevation, NSTMI myocardial infarction. Go to the other options. I-21.29. I-21.29 is STMI involving other sites. ST elevation myocardial infarction involving other sites. And what is option D? I-21.3. I-21.3 is STMI myocardial infarction of unspecified site. Okay. So here what will the doctor code? Okay, what is the patient having, or why the patient is in the emergency department, or the patient has come to treat what? Okay, to treat which condition? That is what we have to code. Okay, so initially the patient came for STMI. So, but then after the treatment, after doing the treatment with the thrombolytic therapy, STMI has been changed to NSTMI, right? So, what diagnosis you will code? What diagnosis the doctor will code? Will the doctor code for STMI only, or will the doctor code for NSTMI only, or will the doctor code for both STMI and converted final the diagnosis NSTMI? Which one the doctor will code? But you have to find it out. Okay. So here, since the patient is here to treat what, or the patient is here for what condition, That should be the diagnosis. That should be our diagnosis. Okay, because the patient is here. The patient is in with the physician, or the patient is with in the emergency room to treat what condition. That is what you need to code. Okay. So here, what is the condition of the patient? I mean, what that to treat what diagnosis? It is STMI. The patient is here to treat STMI. So you have to code for the STMI code. Okay. So here, what are the codes for STMI in the options that we had discussed? The first one is just acute myocardial infarction, nothing mentioned as STMI or NSTMI. Second, I-21.4 is again NSTMI, which is wrong. Third one is STMI involving other sites, and fourth one is STMI of unspecified site. Here, is there any site mentioned? Any specific site mentioned? No, nothing, right? So it will be unspecified site. So the answer will be option D, I-21.3. Since the site is not mentioned, it will be considered as unspecified. Okay. So you have to code the correct diagnosis will be STMI of unspecified site, I-21.3. Okay. Now let's move to second question. A 34-year-old female who is 38 weeks pregnant with triplets goes into labor and vaginally delivers 2 healthy baby girls with APGAR. APGAR, that's a short form. Okay, APGAR represents appearance, pulse, grimace, activity, and respiration. Short form of the short form for this is APGAR. Appearance, pulse, grimace, activity, respiration. So 2 healthy baby girls delivered vaginally with APGAR of 9. And the third baby is in a transverse position, and the patient is taken to the operating room for C-section, and a baby boy with an APGAR of 8 is delivered. What ICD-10 CM codes are reported on the maternal record? So on the maternal record, what diagnoses are reported? So here you have to code for the triplet pregnancy. The first 2 babies are delivered vaginally, and the second baby is delivered C-section because of the transverse position. So whenever the word transverse, remember that whenever the word transverse position is there, it means it is understood that it will be a C-section delivery. Okay. And the other will be oblique. If it is delivered vaginally, it means it's an oblique delivery. Okay. Okay, so let's move to the codes one by one. What is the first code? The first, always pregnancy, while coding pregnancy codes, it should be O code first. Okay. So what is O32.2XX1? O32.2XX1. If you can check in the ICD book, 2XX1, the last number 1 represents fetus 1. After the X, after the placeholder, the number 1 represents the number of fetus. So here, since it is 3, it should be O32.2XX3 because it's triplets. So number of fetus 3. So it should be 2XX3, which is there in options B and C. So let's move to B and C options only. Okay. So what is O32.2XX3? It means maternal care for transverse and oblique live fetus 3. See, in this first code itself, in the first O code itself, it is clearly mentioned transverse and oblique. Both are there. Both are included. Means few baby will be in transverse position and few will be in oblique position. Number of fetus also mentioned 3. So this is an important code for while coding triplet pregnancy. Okay. If, for example, if in the question all triplets all are delivered vaginally or all are delivered C-section, either of one, then you don't have to code this one. You have to code only for the triplet triplet pregnancy delivery by C-section or triplet pregnancy delivery by vaginally. That code you have to mention. Since here both are present, you have to code this one. Okay. Maternal care for transverse and oblique live fetus 3. So that will be the first code. What is the second ICD in option B? Z37.51. What is Z37.51? The second one, the Z code should be, you should mention whether all the infant born are live born or live birth or stillbirth. So here Z37.51 is all live born, right? So you have to code that also. So Z37.51 represents triplets all live born. Okay. And Z3A.38. As usual, the last code should be the number of weeks of gestation. 38 weeks of gestation. That should be coded finally. So this option is right. Still, let's check the other codes in option C. Z38.61 and 62. Z38.61 and Z38.62. Z38.61 means triplet live-born infant delivered vaginally. And Z38.62 means triplet live-born infant delivered by cesarean. You should not code this one because this means Z38.61. It represents a triplet live-born infant delivered vaginally. It means all the triplets, all the 3 babies were delivered vaginally. That is what it means. And Z38.62 means all delivered C-section. That is the meaning of that. So you should not code that depending upon the question. Here in the question it is 2 vaginal delivery and 1 C-section. So you should not code this. For that you are coding only the first one, O32.2xx3. In that both are present, transverse and oblique. Okay, so you don't have to code it separately. So here the correct answer will be option B. The O code, maternal care for transverse and oblique position 3, fetus 3. And then Z37.51 means all triplets all live born, and then 38 weeks pregnancy, Z3A.38. So the answer is option B. Okay, that's how you have to code for the triplet pregnancy. Any doubts, any clarifications, please mention in the comments. I'll explain it again. Now, third question. A patient presents with hypertrophic scarring of her chin from a burn received 1 year ago. Scare management has failed. What ICD-10 codes are reported? So here from this question you have to identify whether the scarring of the chin, whether that is an initial encounter, subsequent encounter or sequela. That's why they have mentioned it is here the burn has been received 1 year ago. The burn was since 1 year ago and then the scare management has failed. So it means what type of burn it is or what type of condition it is now. Is the patient here to treat initial burn or subsequent burn or sequela? Then you can easily find out the answer from the options within like less than a minute. Okay. So here since the burn received 1 year ago and then the management is failed. So it means it is a sequela. It's not an initial encounter and not subsequent. Because it's 1 year ago, 1 year long gap is there since the treatment is carried out and then scare management also failed. So it means it will be sequela. So for all sequela codes, the 7th position will be the character S, the alphabet S, right? The last character A is initial encounter, which is wrong. We need sequela. That is S. And for subsequent encounter, the alphabet will be D. So here where is S present? In option A and C. But in option A again, initial encounter is present in the first code, T20.03XA. We don't have to report initial encounter here because this here you have to code for the sequela because the scare management is failed and burn received 1 year ago. So you have to code for the sequela code, which is there in only option C. So you got the answer directly as option C. Still, I will explain those codes. Let's discuss what are those codes. Let's find it out. What is L91.0? L91.0 is hypertrophic scar. Okay, L91.0 is hypertrophic scar. And then T20.03XS. T20.03XS represents burn of unspecified degree of chin, sequela. Yes, here the degree of the burn is not mentioned. So, unspecified degree of sequela. So, the answer is here is option C. Okay. L91.0 for the hypertrophic scar, and then T20.03XS, which represents the unspecified degree of burn of chin sequela. Alright. Now moving to the fourth question. A 60-year-old patient with type 1 diabetes mellitus comes in for comprehensive eye examination. He is diagnosed with non-proliferative diabetic retinopathy with macular edema in the right eye. How would you report this patient's condition? So here the patient is having type 1 diabetes. Type 1 diabetes means since birth. Okay, from the childhood. We can't say since birth, from the childhood. So type 1 DM, the patient is having type 1 DM. And the patient is here to treat the eye examination. So what condition, and then he's, what is the diagnosis here? He is diagnosed with a non-proliferative diabetic retinopathy with macular edema. And that's in the right eye. So how will you report this condition? Anyway, let's check all the codes one by one. What is the first diagnosis? E10.311. E10.311. Open the ICD code book, go to E10.311. It represents type 1 diabetes with unspecified diabetic retinopathy with macular edema. Unspecified diabetic retinopathy. No, here it's clearly specified that it is non-proliferative diabetic retinopathy. So you can't say unspecified. So that's wrong. What is the second one? E10.3519. Again, type 1 diabetes with proliferative diabetic retinopathy with macular edema. Proliferative, no. This is non-proliferative. So that's also wrong. What is option C? E10.3211. E10.3211 represents type 1 diabetes with mild non-proliferative diabetic retinopathy with macular edema right eye. Yes, this is exactly the description what we need. Still, let's check the other last option also, E10.3511. What is E10.3511? Again, type 1 diabetes with a proliferative diabetic retinopathy. No, this is non-proliferative. So that's also wrong. So you already got the answer as option C, E10.3211, which is type 1 diabetes with mild, that's okay, mild non-proliferative diabetic retinopathy with macular edema of right eye. Okay, that is the answer here. Let's move to one more question. A 21-year-old patient is ingested some wild mushrooms while camping, and she was brought to the emergency room with excessive salivation, nausea, shortness of breath, low blood pressure, visual disturbances, and irregular pulse. The symptoms started within minutes of eating and cooked mushrooms. She reported atropine was administered to counteract the poison muscarine found in some poisonous mushrooms. So here what is the poison? Muscarine is the poison which is found in mushroom, and then medicine which was administered to her was atropine. Okay. Relief was almost immediate, but we are holding the patient in observation overnight. What ICD-10 CM codes are reported? So here the other symptoms which are mentioned. What are the other symptoms mentioned? Salivation, excessive salivation, nausea, shortness of breath, low blood pressure, visual disturbances, irregular pulse. All these are symptoms. But we already have the diagnosis as poisonous mushrooms, ingested of poisonous mushrooms. That is what we need exactly. And the poison is also mentioned, muscarine. Okay, let's find it out. So, and here immediately since the mushrooms had eaten, or since the symptoms had started, they have taken the patient to the emergency room. So this is an initial encounter. This will not be a subsequent encounter. So you can directly skip option C, as it is a subsequent encounter. The last alphabet is S. If the seventh placeholder is if the seventh character is S, it means it's sequela. But this is not sequela in our question. It is initial encounter. Anyway, let's find out the answer. Let's go to the options. The first code, A50.9. What is A50.9? A50.9 is congenital syphilis, unspecified. This is not syphilis. So that's wrong. And also congenital it is mentioned. So it's wrong. What is option B? T62.0x1A. T62.0x1A. Toxic effect of ingested mushrooms, accidental, unintentional, initial encounter. Those words also you have to be very careful while reporting. This is accidental, accidentally eaten, or not intentionally, right? Unintentional. So you have to make sure the each and every word in the description. You have to be very, very careful with each and every word in the description. Okay. So toxic effect of ingested mushrooms, accidental. Yes, this is accidental. Initial encounter. Yes. The same if you go to option C, it will be sequela. So that is wrong. T62.0x0x1S is the same description. Toxic effect of ingested mushrooms, accidental, sequela. This is not sequela. And the last option K52.29 is other allergic and dietetic, gastroenteritis and colitis. No, you already have the correct. You already got the correct code. The initial encounter A. So answer will be option B. T62.0x1A. Okay, toxic effect of ingested mushrooms, accidental or unintentional initial encounter. Okay, be careful with the each and every word in the description. So here answer is option B. Alright. So friends, these are few important guidelines and questions, more questions from the CPC examination, from the practice, previous years examination, and few guidelines, few practice questions. Okay. If you find this video useful, please like and share. If you have any queries, please mark it in the comments. I know, especially for the freshers, you will get, or for the new students, you will get lot of queries or lot of doubts in your mind. I'll be definitely clarifying it. If you have any queries, please mark it in the comments. Also, if you are new to the channel, please subscribe and please watch out all my videos. At least few videos will be useful. Not only few, all the videos will be useful for, especially for those who are preparing for the examination. So stay tuned for more videos and more guidelines, more chapters. I'll be coming back with more chapters. Okay. So thank you so much friends for all your support. Stay tuned. Bye. Take care.